Hi there, welcome to my channel, and this is the second part of the discussion related to topic how to do behavioral observation. There are two sections in this video. The first section is discussing the possible topics to include in behavioral observations section of reports. You may address many different topics in the behavioral observations section of a report, although for different cases, certain topics will be more important than others. Physical appearance. Although it is not necessary to comment upon physical appearance, these observations can provide clues to examinees' physical, psychological, and neurological functioning. When describing physical appearance, you will usually just write one or two sentences, such as, Victor is an attractive 4-year-old boy with dark coloring and straight jet black hair. Or, Martha is a tall, slender adolescent with a confident manner and an engaging smile. You may note aspects of appearance such as the examinee's height, weight, and build. For example, lanky, stocky, or underweight. And also grooming. For example, was the examinee's clothing neat and clean or dirty and disheveled? If an adolescent boy comes to the session with shoes untied, one side of his shirt hanging out, and hair disheveled, you may begin to hypothesize about poor organizational skills or rebellion against adult authority. Repo. With some people, repo is established easily, but with others, it requires more time and effort. Some people are just slower to warm up and respond to new situations than others. Observe how the person relates to you. Is the person behaviors friendly, abrupt, shy, frightened, cooperative, aggressive, or respectful? Observe also how the relationship changes over the course of the evaluation. Typically, as individuals become more comfortable with you, they become friendlier, more talkative, and more relaxed. Similarly, repo is maintained easily throughout the assessment with some individuals, but for others, repo may be disrupted. For example, if a child becomes unduly frustrated with a certain subtest, you may see that her attitude and motivation change for the remainder of the session. Be sensitive to changes in rapport and be ready to pause or even stop testing when necessary to re-establish a good relationship. The third point relates to communication. The speed, pitch, volume, and rhythm of speech can make a person difficult or easy to understand. Both accents and regional dialect can affect a person's ability to understand or be understood. The ease of conversation also differs among individuals. Also consider the quality of the responses. An example, detailed or brief, impulsive or reflective. Note how well the person pronounces words, uses words, conforms to rules of grammar, and maintains conversation. Also, observe nonverbal communication. Does the person use many hand gestures to make a point? Do the nonverbal behaviors seem appropriate for the situation? Does the person respond appropriately to your nonverbal communication? In testing, however, the goal is to cover the range of functioning or a person's operating levels from easy. Some people do not seem to be bothered by errors or not knowing the answers, whereas others become sullen, angry, or frustrated. Observe how the individual reacts to the difficult items. Some work harder, some seem to accept the fact that the items are too difficult, and some quit trying and may even refuse to go on. People also respond to praise and correction in various ways. Some people will smile when you say, "Well done," whereas others do not seem to notice the praise. People also react differently to verbal and nonverbal encouragement. Observe what type of reinforcement seems to motivate the person to put forth the most effort. As a general principle, remember to reward effort, not the correctness of the response. It is easy to get into a habit of saying good when a response is correct and saying nothing when a response is incorrect. Remind yourself to say good to both correct and incorrect responses. Occasionally, praise the effort instead of the response. For example, you may say, "You are really working hard," to the examinee. Next is the attention span. A person's attention can also vary throughout the evaluation. The person may be attentive during the beginning of the assessment but have trouble sustaining attention throughout the evaluation. Attention may also vary according to the type of task. For example, novel subtests may hold children's attention longer than subtests with familiar tasks, for example, math computations, or subtests that use concrete materials to manipulate may sustain interest and attention better than those that have oral questions or pictures. Note the length of time that an examinee can sustain attention. Attention span relates to distractibility. Some people are distracted by extraneous noise such as an airplane flying overhead or a conversation just outside the testing room, whereas others do not seem to be bothered. Observe how well the person attends to different types of instructions and tasks. For example, after you give directions for a task, the person may appear confused. Attempt to determine if the confusion stems from poor attention, trouble understanding the language, or difficulty determining exactly what to do. When a person asks you to repeat the instructions, this may indicate the person wasn't listening or that he or she was listening but did not understand the directions. Activity level. Observe a person's mannerism and movements before, during, and after the test to provide clues about anxiety level, boredom, impulsivity, and coordination. Observe what a person is doing as you first greet him or her. Is she sitting quietly reading a book, passing around the room, or making conversation with the stranger next to her? During the testing, are his movements slow and deliberate, cautious and hesitant, fast and impulsive, or typical for his age? A person may tap a foot, tremble, or fidget behaviors that may indicate fear, impatience, boredom, or hyperactivity. The examiner acts as witness and needs to interpret the behavior for the reader of the report. Okay, from the activity level, we continue to the anxiety level. People often reveal how they feel about the quality of their performance during an assessment. You may observe certain facial expression, an example, a rolling of the eyes or a grimace, or you may hear statements that the person makes. For example, whenever he or she says, "I should really know this stuff," as a comment for him or herself. The next point is mood and temperament. People's mood and temperaments vary. A person may be unresponsive or responsive. The person may seem happy to be participating or fearful of what the results may mean. In some instances, a person's mood is influenced by events that occurred early in the day, such as an argument with a parent prior to school. Problem-solving strategy. Different approaches can be used for solving problems and responding to situations. Observe how the person attempts to solve problems and the types of strategies that he or she employs. For example, one person may try an approach that doesn't work and then quickly try another one. Another person may examine the problem carefully and proceed cautiously step by step. Some examinees solve problems by taking themselves through the solution. Attitude toward self. Self-deprecating, derogatory, or boastful remarks often indicate a lack of confidence, whereas other behaviors such as blushing may be more subtle indicators of embarrassment or frustration. And the last point is unusual mannerism or habits. Some examinees, particularly those with psychological disorders, may display unusual behaviors, such as flicking invisible specks of dust on the table, covering their eyes and ears, spinning a pencil or another object, or ritualistically picking up and putting down a paperclip before each response. Individuals with severe problems may even demonstrate self-injurious behaviors, such as biting on their hands when frustrated or banging their head. Tic-like movements, often of head, eyes, mouth, or cheeks, may also increase when a person is nervous. Be sure to note all odd mannerisms. Okay, we'll continue to the second section of this video. Observing in naturalistic setting. Clinical observations during an assessment are essential, but whenever feasible, supplement them with observations made in everyday settings. Observations in everyday life settings such as a classroom, a playground, a cafeteria, the home, the workplace, or a retirement home provide information about a person's typical behaviors. Although naturalistic observations are easier to obtain for children and adolescents than for adults, they are important for anyone who is assessed, regardless of age. Here are some useful tips. The first one relates to targets. Generally, a trained observer will either record a variety of behaviors or focus on one or two specific problematic behaviors. The referral questions and other test data help determine the types of information to be gathered from the observation. The second tip relates to the guideline. When observing behaviors in a naturalistic setting, consider these general guidelines. To plan carefully and systematically, determine which behavior will be observed, where the observation will take place, and how the behaviors will be recorded. In defining the behavior or behaviors that will be observed, be as specific as possible. Clear and concise definition of behavior will help distinguish the target behaviors from other similar behaviors. For example, you may define cooperative behavior by focusing on the specific behaviors involved in cooperation, such as taking turns during games or working together to build something. Other types of behavior are easier to define, such as hitting or crying. Once you have determined what behaviors will be observed, decide where the observation will take place. If the setting is a school, numerous possibilities exist. If the referral question has to do with how the child is functioning in academic situations, then the best place to observe the child would be during academic classes, possibly during one of the child's worst subjects or during one of the child's best. Once you have decided what behaviors to observe and where those behaviors will be observed, then you need to determine how to collect and record the data based upon the behaviors of interest. Three basic categories of data collection are event recording, duration recording, and time sampling. An additional type of recording is narrative or anecdotal recording. This type of data collection is qualitative rather than quantitative. Yeah, finally we have reached the end of this video. Yeah, these are the resources or references that I use to create these materials. You can search and read it by yourself after this. Okay, thank you for watching, and I hope these materials is beneficial for you. If you feel that this materials is beneficial for you and you are interested to follow my others, my channels to see my other videos, please feel free to hit the like button and also the subscribe button. Thank you.